So 2024 predictions, I would say that we will continue, and maybe not just 2024, but beyond, that we'll continue to see an evolution of our risk-bearing models or our risk payment models. And I think that you'll see an incorporation of social determinants of health, where there will be a multiplier applied to some of those codes. In addition to that, I think that you will also see that some diagnoses codes might be permitted back in under V28, that there might be some metamorphosis, because I think that there were some that were taken out, and there may have been some extreme measures. And so I think you'll find that there will be a metting, right, and accounting done by CMS and through the health plans and physicians, and a discussion there to find something that is more equitable for funding those programs and making sure that patients are served, but then also to making sure that we're providing and we have enough reimbursement allocated to those conditions in order to be able to provide care. I know that in the last week, there's been some talk about telehealth, and I have been reading different posts, and I know that some folks will automatically jump to the conclusion that telehealth is going to go away. But when I read the article and the pieces that were put out by CMS and OIG, it was more around things like DME, so those durable medical equipment, and the companies that are calling and signing folks up for things like urinary incontinence supplies and things like that. I do think telehealth is here to stay. I would like to see, and I do think it may be appropriate, especially with the changes with V28 and the shifting in some of the reimbursement model, that we may see the video component that is required for Medicare Advantage go away. It's not required for HHS, and I think that one of the things that we recognized through the pandemic was that not everybody has access to the technology, that also to, broadband Wi-Fi coverage has been challenging. And so recognizing that telehealth provided open access, I think is important, and I think we'll see more of that. On the Gartner's report, one of the things that I thought was important was the use of AI, and I do think that we're going to see more and more of that. But I want to caution folks. I think that there is a cautionary tale there, and I attended some earlier conferences, some conferences last year where there were speakers around there were some speakers around AI. And one of the things that they were saying was that, today, a human being is more apt to have a mistake than AI. And that, even looking at the example that they used were self-driving cars, and that a human being would be more likely to hit, say, a child that might pass through two cars, right, that you wouldn't see, as opposed to AI. And so were you willing to live with that error rate, knowing that the error rate was lower under AI? And I don't think that AI is necessarily where it needs to be. I think it's amazing. I think that we're doing incredible things, but I don't think that we should, and I'm not saying that folks are saying this, but I don't think we should take our hands off the wheel, right? Or our eyes off the road. I think that there is still an important piece in using, the human being in the process to look over what AI is producing. And I can just tell you, even from the podcasts that I do, when they're translated, they're not always translated appropriately. Or, how many of you use talk to text? Sometimes I'm amazed. I'm an adult, and I don't think I can talk, or maybe my accent is strong enough that Despite speaking in grammatically correct sentences, my Apple phone will often translate it inappropriately. So I think that there's opportunities still. I know things are getting amazingly better. You hear these stories about how the latest AI engines are passing, the medical board tests and, scoring 100% on the LSATs or close to that. And so I do think that there are some amazing wins. And I do think that it's going to improve what we're doing around documentation and providing data that's important at the point of care. But I do think that there still needs to be some oversight there, and that will need to be continued. I don't think we should ever take our eyes off of it. I know is working as a professor as well. There's concern in that community around original works and whether or not doctoral students are doing their own research and writing their own dissertations and doing their own studies. And a lot of stuff can be created today. And the thing is, I still think, like I said, that human diligence needs to exist, lest we continue to produce, right, the same things or produce things that are not necessarily accurate. So I think that we have a responsibility there as educated professionals. One of the things that they had talked about in that report was around provider burnout. And I do think that that is a real challenge. And I do think that there is a shortage. We know there's a shortage of clinicians in the medical field. And one of the things that I predict for 2024 and beyond is that we will see a blurring, if you will, of licensees and the ability to do different things that maybe weren't permitted before. And we've already seen that. CMS is now permitting certain professionals to do more things. I know several states are pursuing and considering allowing licensed clinical psychologists to prescribe. That was usually something that was only allowed by psychiatrists. So there are, we do see more fluidity. I don't want to say laxing or lapsing, because I think that a lot of these professions or a lot of these types of clinicians are totally acceptable to do this work, and we need to permit these types of things because we are lacking enough clinicians to be able to do the work. It's just, it is something that I see coming. And one of the other things that the Gartner report commented on, and I agree with, is that we will see, in fact, I don't think they actually gave it enough attention, was hospital at home. I do think that we'll see more and more of that. And I know that, and I think that CMS and others expect that as well, because we saw the developments around caregivers, right? And being able to be reimbursed for services there. I don't think it's enough. I think that we will get to a point where we rely more and more on caregivers or on the home setting. And that leads me to the other thing that I think is an issue and something that will need to be addressed is that, while we're pursuing hospital at home as an opportunity where a patient can be cared for, again, knowing that, there's no panacea here. There's no silver bullet. And so the same thing here, not all those homes are going to be appropriate to care for patients for a variety of reasons. And so being cognizant of that and being willing to, and I think that would be my overall argument with AI or anything where, the burden is eased and we feel that we can make more circumspect or wider applications of solutions that we just are always just checking. I know I might sound like I'm a little intent and intense on that. But I think that it's important to constantly be checking in and making sure that what you expected to happen, again, that self-driving car, they've actually taken back some of those permissions, right? Or some of those abilities now, that you still need to be paying attention. And I think the same thing here that, AI is great, technology is great, widening scope of practice for certain licenses and certain clinicians. permitting other sites of service and other sites of care like hospital at home are all really, really great recommendations. But just again, remembering that you can't just set something in motion and expect that it's going to stay on track all of the time. That there will be some times where humans need to intervene and be checking to make sure that everything is going in a way that they intended. The other thing that the Gartner's report said, though, too, were some recommendations, and I was concerned about this, and this was checking in with your EHR system, or the company that provides your EHR about using their services. And I think that that's another place where diligence will be important when you're looking at companies to provide AI, bringing in data, looking at your EHR system. I've worked with a lot of EHR systems over the years, and I can tell you not all are created equal. And it's not really a criticism. It's just that there's a lot of information out there. And so how do you make sure that everyone is doing their due diligence and pulling in exactly what's needed? And I've seen a lot of EHR systems set up to maybe have more of an emphasis in one area than say another. And I can tell you, one of the EMR or EHR companies that was mentioned in that report, not a lot of experience when it comes to making sure to capture quality, making sure to capture risk on your populations, making sure to capture, social determinants of health. And so a lot of pieces are lacking. And so I don't know that I would necessarily say that, my EHR vendor, sorry, EHR vendors, but I don't think that I would say my EHR vendor is going to have the solution. Again, I think it's all about doing your due diligence and making sure that you're choosing and picking the right tool. And I'm also a believer in you get what you pay for. So it also made the comment about looking at less expensive solutions. That may be the case, but I don't think you're going to be able to be there very long. And I would say I would want to be ready. It doesn't mean that you don't put something into practice if that's where you need to start. But I would definitely have a vision of when what my long range plan would be. And what my planning would be, and when I might depart from, that less expensive solution, so to speak. And that's not to say that there aren't less expensive solutions out there that are phenomenal. But again, it all comes down to due diligence and really understanding where you want to go. Definitely think that there's going to be apprehensions. And when I look at the Gardner report, it's very much similar to what one would expect with an adoption curve. You have some groups that are, and usually it's a smaller percentage, right, that have already adopted or considering adopting in the next 6 months, 12 months. You have quite a few that are seeing it as being something further down the road. And then there were quite a few too that I saw where they were, they didn't even know where they were, wasn't yet on their roadmap. And I do think that we will see that curve. And I think that's just the nature of our society now with information and how accessible information is and how accepting people are of new technology. So I don't think the adoption curve that they shared was any surprise, but I do think that unlike maybe in years past, that we will see adoption happen much sooner. And just knowing the emphasis on trying to get medical groups and organizations to move into risk-bearing contracts. The intent is to have everyone in a risk-bearing contract by 2030. And so in order to be there, you're going to have to use technology. You're going to have to use AI. If you're going to do it successfully, I think it's just too difficult. And I agree with Gardner when they say that there is such an emphasis and a lot of time, clinicians' time spent on the administrative task. And so to the extent that you can lessen some of that time, I think is important. So I do see adoption happening more quickly than maybe it might have been with technologies of years ago. There was a time that there are still offices that operate on paper, but it's not going to be where you can hold out and not adopt using AI and using some type of technology if you're going to be involved in these associations or these relationships. And you certainly won't be as successful as you could be. And I think that the cost and the other pieces that are coming about in the models, the emphasis on quality measures, the emphasis, more of an emphasis on total cost of care, at the reduction of risk reimbursement, that you're going to have to rely on AI to help you. And so I do think medical groups will be, and healthcare entities as a whole will be adopting AI at a much more rapid pace. It just may look differently. And I think that there will be a lot of lessons learned over the next couple of years as to, what's helpful and what's not. And like I said, there's going to be tools out there that are helpful, and others that maybe. And also too, I think it's important to check in with the different groups within your organization because the needs may be different. And so I think this is really an opportunity for us to be integrated. We hear a lot about silos. I get to participate in a lot of opportunities around conferences and speaking, and even just being in Washington, D.C. a few months ago, hearing the different government agencies talk about silos. And then I go to healthcare conferences and I hear about silos at medical groups and in health plans. And I think that this is an opportunity for us to be really integrated. And so to the extent that, and what I was saying earlier, if you can only start small, I think that's fine, right? That's where you're at. But I would definitely have on my roadmap as to how you're going to involve the other constituents within your groups, so that you can have an integrated system, because I think that's the only way that it's going to work and be successful, so that you're really achieving and speaking to the different goals. And I think there was another prediction in there about, and it made the comment that people weren't interested in accessing their health record because now that the looming of the pandemic had gone by the wayside. So the remark was, I want to make sure that I represent it correctly. The remark was that during the pandemic, people wanted that prediction that Gartner had made back in 2019 didn't come to pass. And the reason for it was, or at least what they said, was that now that the pandemic has passed, that folks weren't really interested in accessing their electronic medical records or having access to that on a system of choice. I don't think that's true. I do think that there's a lot of, well, number one, it started before the pandemic. But number two, I think that there's just a lot for folks to focus on. And so maybe it's fallen by the wayside. But I honestly think, and I may be controversial in saying this, but I honestly think that we haven't been able to do it. And so that's the excuse that we give. Because I know as a person, I want my medical record. I want those for my family and my children. I think that it would just make it easier, for patients to have access to their medical records. And I just think that either one, folks haven't figured out how to make money off of it and monetize it. Or two, we just haven't figured out how to bring it all together. And there are groups out there that are holding on to these fiefdoms and not releasing data. And they need to be able to, there's a lot of politics, I think, that are going on there, that are preventing people from getting their health record like was intended. And would like to see that recommendation and that, that prediction definitely come to fruition. I think it's an important one. We can't expect people to take care of their health and be involved and engaged in their health if we're not willing to share with them the information that's important to be able to do that. And so that's one prediction that I would like to see come to pass. And again, I don't think that it's for the reasons that Gardner stated, that people aren't interested in accessing those. I they absolutely are. We always have of providing that information. And I think that's more acceptable is that ambient scribe. I definitely think that that is something that's in place in a lot of offices. Again, I think that it'll be important to do one's due diligence, that it's not enough to, scribe, have that scribe running in the background. You'll need to make sure that you check the notes. I think that those are ways in which erroneous diagnoses can get into the medical record, and that can be problematic, not only from a reimbursement standpoint, but from a patient care standpoint and making sure that the right medications, right, are being prescribed or that that patient is getting the right services and the right level of care. So I definitely think that's something that will continue. The other one that they mentioned, I would agree with too, is that automated consumer messaging. I love that personally. Those reminders of when you have an appointment. And I think that a problem that we've seen across healthcare has been patients not showing up for appointments for various reasons, those no-shows. And so this makes sure that for the time slots that patients are taking, that they're showing up, and that if they're not, or they're stating that they're not coming, that there's the ability to reassign that time to another patient. And so those are things that are currently in practice that I think are important bits of technology that will continue for clinicians. The other thing I would say, if I were to pick something on here, what's following up, they have patient care navigation, I think is important. I know you mentioned about the search function. So the medical literature discovery, I think is important. I think that there's opportunities there to make sure that whatever we're pulling up is appropriate. And so there's still some work to be done there in the search engines as far as what do you pull forward that's relevant, but then not be so restrictive that new findings, right, would still make it to to that search as well, whatever search engine that you're using. So I think that there's opportunities there. But I definitely see that something as being helpful. The other one where I think that there's a big opportunity is around patient education. And I think that there are opportunities to train the models to be culturally aware and respective of other cultural needs and other developmental needs related to patient education. So I think that there's opportunities there. And I think also too, it's just good practice to provide education in a variety of ways. We know, I don't know about you, but I go into the physician's office and I meet with my doctor, and I'm trying to remember in my head all the questions that I wanted to ask. And half the time, I write them down, but I don't always get them out. And then I'm trying to remember what he or she is getting back to me, whether it be for me or my child. And I walk out and I'm often befuddled, and I might get that patient summary, and it's not always as intuitive or as explanatory as maybe it needs to be. And I still have questions. And I think that that would probably be the case for most people out there. So I think that the more opportunities that we have to get information, to process information, maybe process it differently. Hearing it might not be the appropriate way. The specific words that the physician used might not necessarily be helpful. And so I think that there's a real opportunity to expand how we do patient education. And again, to be able to, we know in schools that it's important to differentiate instruction, that people learn differently. We have different ways of processing information. Certain words or examples might resonate with us that don't with others. And so I think that we have an opportunity to use technology to augment and ameliorate those different learning styles as it relates to patient education. And I think by respecting different cultures, that you may have the opportunity, right, to have better health outcomes because you're speaking in a way that resonates and would be better received than how it may be today. The other thing I would say is that around patient education is that, we know too, just in learning principles, we need to hear things multiple times in order for them to be taken in and, integrated in our thinking. And so again, that short visit at the end, like I was explaining, usually isn't enough to really change behavior. And so you have the ability to give bits of information over time at frequent intervals in a way that's culturally responsive and aware. And also, like I said, takes into account and differentiates how people process information. I think is really important, and think that technology could be brought to bear there would be really important.